Brace yourselves, New Zealand. It's going to be a COVID Christmas. While numbers have plateaued at 3,000 a day, one modeller has said there could be 3 times that number out there, as many people are either asymptomatic or just not reporting their positive tests. Today, health officials said they're preparing for a summer wave, as official cases could peak at around 11,000 a day by the end of the year, because new Omicron variants are more infectious. And hospitalisations and deaths could even exceed the most recent peak in July. Adam Hollingworth reports.
Last year we were hanging out for a Christmas circuit breaker from COVID. This year it's the opposite.
The model shows daily cases could rise to a level similar to our peak in July, about between 10 and 11,000 cases per day.
Te Whatu Ora called its first news conference in 2 months to give us the warning. It's partly due to new strains competing for dominance.
We're starting to see commentators around the world talking about this, is this idea of a variant soup or a variant swarm.
Here's how Te Whatu Ora's modellers think Omicron could hit a new peak by the end of the year, assuming the new variants are just 10% more transmissible.
As much as we all wish it were the case, we're not out of the COVID woods yet.
A Christmas checklist is being prepared for actions we can take on holiday.
Get vaccinated when your dose falls due, test if you have symptoms, isolate if you test positive, and be prepared for COVID when planning your holidays.
The drive is on for healthcare workers, but many countries are looking for them.
The U.S. needs more than 200,000 new registered nurses every year to meet demand.
That's a worry for overloaded hospitals here ahead of the expected peak.
Probably somewhere around 8 to 10% shortages exist currently, but we are working both to recruit internationally but also to increase our pipeline.
Te Whatu Ora's lowering the minimum age for eligibility for the second booster for Māori and Pacifica from 50 to 40 years old.
The risk of death from COVID-19 is around twice for Māori and Pacific people, and that risk kicks in earlier, around the age of 40.
Te Whatu Ora will review its booster recommendations in the new year as our immunity wanes. What may help? MedSafe is considering applications of vaccines aimed specifically at Omicron's BA4 and 5 variants. Adam Hollingworth, Newshub.